kakati oba tusobola okujjanjaba obulwadde obukankanya ensi yonna abasawo baffe mwebale.
Whereas Uganda has relatively managed to contain the spread of the virus, long-distance truck drivers from the neighboring East African countries are now posing a new challenge. All Uganda's latest 19 of the 20 cases have been registered from truck drivers coming from either Kenya or Tanzania. Of the 11 latest confirmed cases, 6 are Tanzanian truck drivers who arrived from Tanzania via Mutukula border post, while 5 were from Kenya, 3 of them entering through Malaba, while 2 from Busia border post, raising Uganda's COVID-19 cases to 74. At Kololo, while handing over the donated cars to the Minister of Health to help in the management of COVID-19, President Museveni acknowledged the problem of truck drivers, saying government is coming up with stringent guidelines.
But in Uganda and in many parts of East Africa, the roads are good. Somebody has given me a study that you have got a petrol station almost every 15 miles. You find a petrol station. There is no way the driver can be stuck in many of the East African roads. The situation has changed. That therefore, the turnboy is actually an encumbrance. They have made a very good study. I want the team, the National Task Force, to study that. Because if we go to one driver per vehicle, then that reduces the numbers that we need to deal with.
The president says this should be done in a way that will not affect trade and the economy, urging communities to stop mixing with the truck drivers.
Because remember, we have a problem. We need the cargo. We need the cargo. We need the goods. Our goods to come in, but also our goods to go out. Our coffee must go. All these things must go. But at the same time, we don't want the disease. So, obugambo bubiri bannange tokwata ku driver ne driver takwatako. Don't touch the driver, and the driver should not touch you. Of course, these drivers, they have been coming, so they have their friends along the way. But we are thinking that because of the danger, their friends will say, please, don't water. Let the virus first go away. But now it seems that one is not working.
He commended frontline health workers for the job well done, saying Ugandan scientists are working hard to develop a vaccine as a lasting solution.
I've been discussing with our scientists. They are sure that a vaccine can be developed. And they have already started working on it. But I've also seen that the British are working very hard to develop a vaccine. Maybe other people are also doing the same. So that's the real answer. But that may take some months. So therefore, in the short run, prevention is the only way. On Tuesday, I will give a detailed brief. That's why, therefore, I'm very glad with the response of the Ugandans. First of all, they have listened to the advice. I salute the public of Uganda. You can see how effective it is. The villages, you cannot go there and you hide yourself. Therefore, all the others, please, especially the ones in the towns, copy the example of the villages.
The cars, 45 in number with some still in the bonds, will for the first be distributed in the selected border districts and regional referral hospitals across the country as government looks at acquiring a fleet of 1,350 vehicles to cover the whole country.
Your Excellency, so far, we have 45 vehicles, and we want to thank all the people who are donating, we know that more are on the way. And even though there is this dark cloud of the virus, still we are celebrating the hearts of gold that are getting out to give whatever they have.
Out of the 74 confirmed COVID-19 cases in Uganda, 46 have recovered and discharged, leaving 28 active cases and no death registered.
45 cars have been flagged off.
The president flags off this fleet of cars, very grateful to Ugandans, especially in the villages, for their vigilance in the COVID-19 fight. But again, a bit disappointed to those section of Ugandans that are interfering with the work of health workers, calling them enemies of their country, something he says must stop. Bernard Higa, UBC TV, Kololo.